We will send things over to Eve.
All right, thank you, Matt. Well, when couples make the decision to have a baby, it isn't always easy. Many need help to turn their dream into a reality, and the experts at Reproductive Medicine Associates of Pennsylvania say they understand. They helped the Mittman family from Allentown become parents to little Isabella. Steve Mittman, who you might know from the radio, and his wife Jennifer joined me in the studio this morning to share their story. Guys, good morning.
Good morning.
Thanks for being here and for sharing your story with all of our viewers. And let's rewind, I guess, 3.5 years back, you guys. What was it like? What were you going through? And when did you realize, boy, this is taking a little bit longer than it should when you were trying to have a baby?
Well, we were ready to be parents pretty much immediately after we got married. It wasn't that easy. It took a year, and then 2 years led to 3 years, and a little over 3 years. And Jennifer was a little bit more anxious than I was. I was anxious to be a father, but I wasn't so worried that we were necessarily having trouble per se. I just thought, relax and it'll come. Well, that's not the case. We went to several specialists, both myself and Jen, and basically all roads eventually led to RMAPA. And so 3.5, 4 years later, we have our beautiful little Bella.
Yeah, and Jennifer, you know, all girls, we all dream of having kids and becoming mothers. What was that like for you guys, you know, emotionally as a couple? It must have been a really rough time, to say the least.
It was difficult, but it's made us stronger in the long run.
And what was it, guys, that led you to RMA of PA?
Like I said, we went to many different specialists, many different doctors. A lot of them recommended RMAPA. We did our own research. This is not something you can sit back and just, you need to be proactive and check it out. Do the research. There's statistics as far as success rates that's available to everyone, even online. It's called SART. Basically, we realized it's not happening on its own. We are going to need a little extra external help. And we realized that that's kind of where it's at. And we initially went and we spoke with Dr. Schillings a little earlier on in the whole process. But it's not that we weren't comfortable. It was more my thinking that if we just sit back and relax and not be stressed, it's going to happen. Well, it didn't. So eventually we ended up back with Dr. Schillings at RMAPA. And that's our story.
Yeah, once you guys got there, did you start seeing signs of encouragement and hope? You know, what was the treatment like? Was it exhausting?
It was a time commitment for the treatment. It was definitely a commitment. It was stressful, but a wonderful experience. I would do it over and over again. It was great.
And after this long journey, let's get things a little happier now. What was it like? Take us back, if you don't mind sharing, the day you guys found out you were finally pregnant, 3.5 years.
Well,
just surreal. It's incredible. Anytime anybody finds out that they're pregnant, it's a magical experience. But when it's actually something that's told you that it may not happen, in fact, it probably won't happen, and we were told that by not just one or two, but several different doctors and specialists. It's, as you can imagine, just the most incredible feeling in the world.
Yeah. Did it feel like surreal? Like you couldn't believe it?
That's right.
Yeah, and then after that, everything, good pregnancy, everything was great.
Yeah.
So then the end result we want to introduce you to is little Isabella, or Bella as you guys call her. And I understand, Steve, I think your mom's going to bring her out. Oh, she's right around the corner here. Drum roll, please. Come on out, Isabella. Here she, oh my goodness,
Hi,
you guys.
Bella.
Worth the wait, right? Oh, look at that little pink bow. Here she is.
Hey.
Hi.
So,
this is her big TV debut, I think.
This is Bella.
And hi, Bella. What a cute dress. Oh my goodness.
Thank you.
Worth the wait, huh? Look at those cheeks. So talk to me a little bit about why you guys wanted to share your story. RMA of PA just opened a new facility here in the Lehigh Valley, and I know you guys kind of helped put together a little short film, right?
Correct. What we did was we reenacted our entire process leading up to the birth of Bella, what we went through. And it's a 15-minute short film. It's hard to crunch in 3.5 years, as I'm sure you can imagine, but we did it, and it leaves obviously some elements out, but it crunches that entire time period into our story of the birth of Bella and just the precious miracle of life itself. You asked, why are we doing this?
Yeah.
Because, you know, it wasn't easy for us. It was incredibly difficult. The toll it took on our relationship, what we were going through, just looking at the outside world. You go to the grocery store, you see everyone with kids, with children, with babies, and it's a God-given right. You assume, it's just, you take it for granted that when you're ready, you have kids. And it's not that easy with everyone. There's also a stigma about it. people don't talk about it necessarily.
And it's very common. I know even you know, some of my friends who just got married, a lot of them are worried about this or dealing with certain issues that they're concerned about. It is very common, but like you said, Steve, for some reason it's not a topic of conversation usually. It's kind of hush-hush.
Now that we are speaking about it publicly, we're finding that this is exactly what you said. Unfortunately, so common, but again, like I always say, fortunately, there is so much technology and the experience of people like RMAPA that just things can be done. It's not, we're not living 30, 40 years ago in the past. There's so much that can be done these days.
Yeah. Well, Bella's, you do like TV? Are you waving? Can you wave? Can you wave? I'm putting you on this. Oh, good job. Oh, look at that. And guys, what is your advice to other couples dealing with similar issues and the uncertainty as to whether or not they'll be able to have a family?
She likes to impersonate the Incredible Hulk. My advice is, well, it's a personal journey. You have to get to this end point, this conclusion on your own, but definitely go seek help. If you think you're having trouble, don't be ashamed, embarrassed. There's no reason to hesitate. Just go get a consultation, I suppose, with RMAPA. There's just so much that can be done, and it doesn't have to be our exact procedure. There's incredibly minimal invasive procedures and just simple fixes, if you will. I mean, I don't want to get into the medical. That's for Dr. Schillings later on, but some things are incredibly simple. That just a consultation might set you on the right track.
And as you can see by adorable Bella, there's hope out there. So guys, thanks so much for sharing your story. Bye, Bella. Can you wave bye? Bye-bye. Thanks so much. And as Bella just is waving bye, we will be right back. But coming up in just a few minutes, what you need to know about infertility and the details about a new treatment facility right in our own backyard. We'll speak with a doctor next. Stay with us. Well, they have helped both men and women with even the most complex fertility problems. And now Reproductive Medicine Associates of PA, or RMAPA, is expanding its services here in our area. Here to tell us about the latest advancements and treatments is Dr. Wendy Schillings. Dr. Schillings, good morning.
Good morning.
And we should mention you were also the Mittman's doctor, so
Yes,
it's nice who we just met, obviously. Let's kind of set the scene first, Dr. Schillings. How common is infertility, and what are the causes of the problem that we know?
Well, it affects 10 to 15% of all couples. The two most common causes are male factor, as well as fallopian tube problems. But ovulatory factors in women is also a very common problem also.
Okay, and RMAPA of the Lehigh Valley just had its big grand opening. Congratulations.
Thank you very much.
Tell us a little bit about the facility and the services that you guys offer.
The facility is now more conveniently located and much bigger, and we tried to set a nice, relaxing setting for patients. It's at 1401 North Cedar Crest Boulevard.
Great.
Right off of Route 22, so it's easy access for all patients. We offer all sorts of infertility treatments and reproductive medicine treatments as well.
Great.
They may be as simple as hormonal problems, treating with hormonal medications. We also do things with ovulation induction therapies, where women may need to be monitored at our facility. And then we also do the more advanced treatments of in vitro fertilization, IVF, as well as pre-genetic diagnosis, or PGD.
Great. And talk to us a little bit about success rates. Are these treatments, would you say, successful overall? I mean, how often do couples that struggle with infertility actually get the end result, an adorable Isabella like the Mittmans did?
Well, we've gotten a lot better over the years. Without treatment, unfortunately, couples trying for 3 years, they only have a 1 to 3% chance of success.
Okay.
However, even without the most advanced treatments such as IVF, about 70% of the couples who have ovulatory factors can expect to get pregnant if they're willing to go through all of the appropriate treatments.
Okay. So would you say the sooner the better to seek treatment if you think you might have a problem?
Well, the typical time to seek treatment is after 1 year if women are under 35. But if women are over 35, we suggest not waiting more than 6 months.
Okay, good advice.
Because it gets more difficult as women get older.
Okay, good advice. And let's talk money. You know, I know a lot of people think, gosh, I really would like to do this, but I have to spend my life savings to try to have a baby. Is that still the case? Is there any financial help available?
Well, first of all, you don't know what treatments that you actually need until you seek help.
So you might not need some of the most expensive treatments like you mentioned. Okay.
Absolutely. However, if you do need those expensive treatments, I try to make people realize that they're probably not much more expensive than if you had a child for a year.
Okay. Yeah.
But in addition, we do work with banks, and try to help women that way. And in addition, if you qualify for certain studies and want to participate in studies, there can be significant reduction as well.
Okay. And I know you folks are getting ready to embark on a 2-year public service project. Tell us a little bit about what the project's all about.
Well, there's a lot of misconception about infertility, and we really want to get the word out and open up the conversation and try to make people understand that this should not be a taboo subject.
Right.
So we're going to start with a series of lectures. The first lecture is going to be on October 7th along with the Mittmans.
Oh, great.
And it's going to be called The Stork in the Road. And that will be held at Chris's Restaurant on October 7th.
Great.
In addition, you can look at other things that we're going to do for the year at RMAPA.com. We will have them all on our website, what we're doing throughout the year.
Super, super. And the overall goal, would you say just getting rid of that stigma, raising awareness? Is that what you guys really are focusing on?
Absolutely. We want people to understand and to seek help when they need to, and not put it off and not say, oh, I'm afraid to look at that. It really is a common problem. And if people deal with it, it may not be as scary as they think.
Yeah, and I was going to say, as a physician, what's your best advice to the couple who might be watching who says, this sounds like me, I'm dealing with some of these issues? What's your advice to them?
My advice to them is please come in, get checked out. You can go to your regular OBGYN first. They can do the initial, but then if you need more help, they should refer you to a reproductive endocrinologist that subspecializes.
Okay. And lastly, what is it like, Dr. Schillings, for you as a physician, you know, with all of these advancements in technology, we're able to do so much, and then seeing a couple like the Mittmans, I know it's a lot of hard work on your part and on their part, but seeing that beautiful Isabella and, you know, all that hard work paying off, what is that like for you?
Oh, it's so wonderful. I mean, every day, and now we are able to more and more call patients with positive pregnancy tests.
Great.
And it's just a wonderful feeling. The nurses and I all get together sometimes and we'll call and do a group call.
Aww.
And it's just a wonderful feeling when we're able to do that.
That's part of the job, I bet.
Absolutely.
Huh? Yeah, it must be nice to
Absolutely.
see the kids come back and visit and say hello as well.
Oh,
so.
they do. And
Yeah.
in the supermarket when I'm out, it's wonderful to see the couples
Great.
and their babies.
Great. Well, congratulations on all of your success and all of the hard work that you do. And thanks so much for educating us a little bit on this important issue this morning. We appreciate it.
Thank you.
Thanks, Dr. Schillings. And stay with us. We are coming right back in a matter of minutes.